Your tree may look fine on the outside, but something unusual could be happening inside. In many cases, this is linked to Phytoplasma prunorum. You may notice signs like symptom and evolution of the disease vary greatly according to the crop and varieties in question, the environmental conditions, the age of the orchard, and the rootstock on which the grafting was made. Initially, a yellowing and rolling of leaves along the mid-rib axis is observed, often localized on some isolated twigs. Irregular intervenal chlorosis can also be seen in some cases. The untimely appearance of buds in general and the breaking of leaf buds before flower buds in particular are other clear signs of the disease. Later on, several disorders are patent on branches, such as the growth of weak, slender shoots with small leaves and the proliferation of irregularly distributed dried twigs among healthy ones on branches. Even though the outer bark looks normal, the vascular tissues of branches develop discolorations that are evident when the wood is exposed. Premature defoliation of these branches may occur, and they may later dry and fall. This condition often appears when the symptoms of this disease are triggered by a type of bacteria called Phytoplasma prunorum. Infected planting material is the main source of introduction into healthy areas over long distances. This can be via young plants, budwoods for grafting, and especially vegetatively propagated rootstocks. Another potential means of propagation at the level of the orchard seems to be through some species of leafhoppers, such as Neo-Alloturus hematoceps and or Neo-Alloturus vertistratus, and less commonly, Sammotetic striatus and Ostroagalia sinuata. This disease can be particularly devastating, since trees can be killed within 12 to 24 months after the first appearance of symptoms. The rootstock also determines the severity of symptoms, and this period may be reduced to weeks if the rootstock is peach. It is important in the Mediterranean area. A few natural methods that may help include: to this day, there is no biological treatment for this disease. When the problem becomes more serious, treatments such as the following may be used. Always consider an integrated approach that includes preventive measures along with biological treatments if available. Once this disease is detected, there is no treatment. The best way to avoid it is to be thorough in the choice of grafting material to minimize the chances of this happening again. Budwoods for grafting should be obtained from healthy trees and preferably not grafted on peach root stocks. Monitor the orchard for signs of the disease and report to the competent authority in case of detection of the symptoms. To sum up, yellowing, rolling of leaves along the midrib axis, along with irregular intervenal chlorosis, can be observed. Untimely appearance of buds and breaking of leaf buds before flower buds, growth of weak, slender shoots with small leaves, and proliferation of irregularly distributed dried twigs. Discoloration of the inner wood, even though the bark looks healthy. Stay informed and protect your plants. Follow for more simple and practical plant care tips.